Hi, my name is Amaya. It's November 17th. I'm doing my proximal lower extremity video. Here's the list I'll be using. To start, I'll be doing the axial-lateral Danielus-Miller method. And so I'm going to first ask my patient to raise your right leg up as far as you can. Yep, that's great. And then I'm going to measure in to make sure that I do have 40 inches SID. If you want to show that, I do have 40. And so now I'm going to make sure that we are shooting right up into that joint space. So I can actually bring her down just a smidge, just to make sure we're really getting up in there. I have the image receptor tucked in at the crest, and it is not touching her thigh, so we know that it's at the right angle. I'm going to collimate just a little bit. Stick my left marker because that is her left leg. Bring it in just a smidge. And can you hold your breath, please? And exposure would be made. So I'm now going to move on to the AP pelvis. And get a detented in. All right, and then I'm just gonna take this from out under you. Okay. And then I'm gonna switch it to in the table and get it onto the pelvis. All right. And bring it down. And then for the pelvis, I do want to be 1 inch for the light at the crest. Get it centered. And then can I have you turn your toes in like you're pigeon toed? Thank you. And then I'm gonna stick my right marker. And then can I have you hold your breath? And exposure would be made. And so now I'm going to move on to AP hip. So I'm going to draw that invisible line and then come 2.5 inches down. Actually, and go right there. And then I make sure that I am. And then her toe is still abducted, foot. And then my marker's still good, so can I have you hold your breath? And exposure would be made. And so now I'm going to move on to the modified cleats. So can I have you bend your right knee up and then lay it out, please? And so then I am gonna make sure that I'm still in the right spot. Can I have you scooch that way on the table, please? Thank you. And then we do want to be right in that space. Check and see. All right. And I'm gonna put my marker. And then can I have you hold your breath, please? And exposure would be made. And so now I'm gonna move on to the AP femur. So can I have you lay your right leg straight and flat? Thank you. And then can you go ahead and turn it again inwards? Yep, just like that. And so for this one, I do want to make sure I'm at the ASIS. All right. Put my right marker. And can I have you hold your breath? Exposure would be made. And so now to get the distal of the AP femur, I'm gonna come down. Got my finger where the overlap is. And I do want space below the knee. And then can I have you hold your breath? And exposure would be made. And so now I'm gonna have you turn all the way up on your right hip and bend your knee because I'm gonna do the lateral of the femur. Yep, just like that. Thank you. And I'm going to start with the distal since I'm already down here. Can I have you scooch back just a little bit, please? Thank you. And I'm going to turn the tube. Bring it right. All right. I can close it in just a little bit. Put my marker. Can I have you hold your breath, please? And exposure would be made. And so now I am going to move it up. I'm going to put my marker right there so I can know where I was. up. And then we do want to be at the ASIS. Okay. And then can I have you hold your breath, please? And exposure would be made, and I am done. Thank you.